Morning. Hello, everyone. Good evening. Okay, so I'm Dr. Iqra Ahmed, and just let me know that can you hear me properly? Yeah, if anyone just can comment in our chat section. Yes, thank you so much for the response. So I welcome all of you to today's free session that we are having on CNS Clinical. Let me introduce myself. I am Dr. Iqra Ahmed. I am from Pakistan. I am working as senior registrar at University of Child Health Sciences, Lahore. And I have done my FCPS from Pakistan, and I've also done my MRCPCH. I gave my clinicals last year in September in Pakistan, which was the first time in Pakistan. And since then, off and on, I've been teaching to a few candidates. Look, some of you might know me that because I'm the one who is regularly posting in the group daily. I come up with activities and I expect people to respond there. But unluckily, unfortunately, we don't get a lot of responses there. Though, what I believe is that if I would have been given this chance, that someone is just posting some activity, I would definitely have been gone for that. So I just want all of you, and I just want to encourage all of you to give your participation in the group as well. I know one of the reasons of not participating is the hesitation that a lot of us have, that we might give the wrong answer or we might be judged and someone will be judging us and everything. I understand that, and that's pretty much okay to feel that way. But let me just tell you that we're not here to judge anyone. We are all here to learn, and particularly our main aim of having this active group was to give something to all of you, all of our all the people who are preparing for it, and give you some guidance and help. So yeah, so I personally believe that most of you should be participating in our daily talks, and that would be really helpful for all of you. But obviously, we're just going. So we hold this one-on-one session, like this online sessions once a week, because I think more people are interested in these kind of activities, and we do get to upload them and on the YouTube as well. So yeah, today someone from the group suggested that we do a CNS session, and we do have one of our participants here who proposed to be yeah, who volunteered for the station. So I think it was Dr. Namrata. Are you here? Can you hear me?
Yes, hello, Dr. Iqra. I'm here.
How are you? How are you doing?
Yes, I'm fine. How are you, doctor?
Yeah, so are you preparing for the clinicals? Are you planning to give them in soon?
Yeah, yes.
Okay, okay, that's great. So yeah, I hope this comes out to be a learning process for you. So you know about the format of the clinical station. I'll just revise for all of the other candidates. You know that clinicals are one of the most important and the most marks, like they have a bigger chunk of the marks of the exam. We have 4 clinical stations in the clinical exam. Each one is of 8 marks, and you can have any of the stations. At times, there are fixed stations. Usually, we do get one of the CNS stations and one of the cardiovascular stations in your exam, and others rest can interchange, but then that's different as well. But mostly you definitely get CNS station. So it's really important. It's a bit tough for the candidate as well, because approaching a child and doing all those things, that can be different as well. Today we decided to do a case of CNS, and it's a station. The total station is of 9 minutes. Outside the station, you are just free. You relax. You don't get any command or anything. You just go inside the station when the bell rings and you go inside. Your time starts, and you are given a certain command. Try to listen to that command very carefully, and because that's going to make all the difference. You get 6 minutes to do all of your examination, everything, and then we have 3 minutes for the discussion part. right? So, Dr. Namrata, obviously we can't do a live one-to-one thing right now, but obviously you can just keep. I know it's a bit difficult to tell the scheme in this way, but just let me just tell you that it can happen in the one-to-one patient exam as well. Because one of my stations I mentioned in one of the groups as well that I had a case of mucopolysaccharidosis in my exam. And I was given the command to observe and do the general physical examination, but the child was really not cooperative, and I was not able to do any kind of examination on the child. I did not touch the child at all. I just asked the parent to show me how the child can walk, the back, and some everything like that. So most of the time I was just narrating it. So it's a good practice to do this as well. So I'll just start I'll show you a picture, I'll give you a command, and you'll just start right away. Okay, doc, because
Yeah.
there's no time in that. You cannot just have a preparatory time and you can think about that. You're just gonna start that. I'm just gonna note down the points in between that what should be done. You'll ask a point, and I'll tell you what the finding is. And then after 6 minutes, we'll have a 3 minutes discussion. And then after that, for maybe half an hour, we will have a journalized discussion on uh this topic and your performance as well. So you're good to go. Yeah.
Yeah. Okay.
Good. Yeah, just let me share the picture and I'll give you a command. Yeah, all of the other participants, you are welcome to note any of we won't say mistakes, any of the things that you note during the examination. And can don't you can you can like, just suggest or write those in the comments, but I would ask you to just not intervene in between, or say you can just note down the things, and at the end we can discuss it from you as well. So let me just share the picture in a second. um, okay, once I start. Okay, so are you able to see the picture, Dr. Namrata?
Yes. Yes. I can see.
Your time starts now. Oh, okay. Your command is I'm Dr. Iqra and I'll be taking your CNS station. This is a 6 years old child. You have to observe the child and do the motor system of the lower limbs. Yeah, please.
May I know the name of the child?
Yeah, it's Alia.
Ali.
Alia.
Alia. Okay. So I enter the room. I give my marks to you, and then, hello, I am Dr. Namrata, one of the doctor here. So I also greet the mother, if is mother present there.
Yes, mother is there along the
So
child.
hello Alia, and hello mother of Alia. Is
Hello,
she
doctor. Yeah,
is
the
she
girl
speaking?
can't. No, the girl cannot speak. The mother says hello to you.
Is she looking at me when I call her hello?
No, no.
So in this, I can see the height and weight looks.
Yeah, the height is above 10th centile and the weight is below 10th centile.
So the weight is good. Okay. So is there any other devices around?
No, there are no devices around.
So I can see she's not. She is small thick. I cannot see actually properly.
She has a small head.
Okay.
Yeah, no other
Small head.
small.
So she is in distress.
No.
Okay. So in this one, I can see there is a scissoring of the lower limb. And is there any abnormal movement or any? Okay.
Yeah, she does some abnormal movements of her upper hand, like she's stretching them and yeah, off and on, but there's no specific fits like
Okay.
movement.
So in the head, is there any shunt or anything?
No.
Okay. I cannot see the eye. Is there squint?
Yes. She has a squint and she's not able to look at you and look at one place. There's a
So it's
squint.
bilateral.
Yes.
Okay. So there is no visible scar or something, deformity.
And specifically where?
I just want to do the like in general. Is there any visible scar or any
No,
deformity? In the lower limb, I can see obviously, and
no,
the hand also. So
no.
okay, so can I? So the mother of Alia, can I expose the child, and can I get consent for that?
Yeah, the child is exposed, the legs are
Okay.
exposed. You can
Yeah.
proceed.
Okay. So can she walk?
No,
She cannot walk, even with the help.
no, she cannot walk with the help.
Okay. So now I'm proceeding with the examination of the lower limb. So how about the tone? I'm rolling the thigh,
Yeah, the tone is
and then
increased all over.
the thigh, knee, and ankle all increased.
Yes.
How about the now I'm checking the power in the hip.
Yeah, so the power is 1/5 in both the limbs.
It's at the level of hip, knee, and ankle. All it's 1/5.
Yes.
Okay. So now I'm going to check the reflexes. How is the reflex in the knee?
Uh, Reflexes are brisk.
Even in the ankle?
Yes, bilateral and yeah, both limbs.
So if I do the clonus, is clonus present
Yes,
bilaterally?
yes.
And I'm going to check the Babinski. How
Yeah,
is the
upgoing, both bilaterally upgoing.
okay? So I would like to finish my examination by doing the sensory sensation, and I would also like to do the finish my examination by doing the cranial nerve and the upper limb examination.
Okay, yeah, you can go proceed. You still have a minute. You can proceed uh, to the upper limb examination.
Yeah, and I also want to like check the back of the patient if there is any
Yeah, you
scoliosis.
can. Yeah, you can do that. Yeah. So the back is normal.
How about is she wearing a diaper? Still in
Yes, she's
diaper?
wearing. Yes, she's wearing a diaper.
Okay. Is there any diaper dermatitis or something? I just want to ask.
No.
So I think I'm done.
Okay. Anything else? You still have around 50 seconds. Do you want to ask anything about the upper limbs or cranial nerves, head side, anything?
Yeah, the command was low limb. That's why I just finished.
Okay.
Even the
So, okay.
coordination, can she do
Yeah.
it?
Okay. So, yeah, tell me your findings.
So today I got a chance to examine 6-year-old Alia, whose weight looks decreased. Although I would like to plot it appropriate chart, and the head size is also small. There is no obvious systematic feature, but there is a squint bilaterally, and I can see obvious scissoring of the lower limb and some movement in the upper limb. And on uh, lower motor examination of the lower limb, I can there was a power there is an increased tone in both lower limb, and the power is also 1/5 in the lower limb, and the
The
reflex
last three
were
minutes
brisk.
have started. Okay.
So
Okay. Yeah,
and there was
continue.
presence of clonus, and the Babinski was upgoing.
Okay. Okay. Any other
So
finding that would
after
you
my
like to tell?
yeah, so from the examination I have done, so this is a case of a upper motor neuron lesion.
Okay. And what do you think can be the cause of this?
Most probably, looks like a case of a quadriplegic CP.
Okay, so how would you say that it's a quadriplegic CP? I mean, did you check for the upper limb? Or did you ask for that?
I just asked in the end to complete my examination for the upper limb, but because of the posture of the upper limb, it was
Okay,
flex position.
okay. And what do you think can be the cause of cerebral palsy in this child?
So first, of course, the child is 6 years, but I would like to ask the complete examination from the mother and also the history of the past. So it can be like in general the cause of CP like prenatal, natal, and postnatal cause.
Okay. And
So
what can,
in
yeah,
there
and
can be any trauma during the birth, or any prenatal, can be infection, any malformation, or the natal can be birth asphyxia, or in the postnatal cause, it can be any CNS infection like meningitis, or
so what can be the abnormal movements in the upper limb? You can't see them. Okay, we'll just drop that. So, okay. So considering that this is a child of cerebral palsy, would you like to investigate the child?
yeah, I would like to investigate after just like I said, after completing all the history and everything and completing the examination, I would like to do the MRI scan if it is not done previously.
Okay. Any other things you would like to do?
And if not done previously, I
Okay,
think
so just
mostly
that.
MRI I want to.
Okay, so how would you like to manage this child?
So for the management, I would like to manage the complications of the CP, like would like to include the neurologist uh,
Okay.
and pediatrician, uh, since there is a tendency to spasticity, to give any antispastic medication. And we'll also, if there is a seizure present, we'd also like to give the anti-epileptic.
Okay, so currently in this child, what do you think is the acute issue that needs to be dealt? Just looking at this child right now. What complications you having visibly that you want
Yeah,
to?
there is a contracture, so I would like to include the physiotherapist and the occupational therapist also.
Okay.
And
So your time's
yeah.
up. Thank you. Okay. So yeah. Uh, you did a good job, Dr. Namrata. Obviously, doing a station verbally and then obviously it gets a little bit of panic. It doesn't get uh, fluent that way, the way you are doing when you're doing a live station. Obviously, the reflexes are different and you'll be doing it in a smoother way, but basically, you know things, and that's a good thing how to do. Regarding obviously the examination technique, maybe one day we will have such kind of station in which we can just practice and I can see we can have an online video on we can do station like that. But just to revise that, initially when you said just make a routine that whenever you entering, obviously you are going to give your mark sheet and they're going to introduce yourself. So after that you get going to get the command. So obviously do remember that the command should be listened very carefully. You did that right, and that was a very good thing. Remember that whenever you guys are practicing for the clinical station, always practice in 5 minutes. I know it's 6 minutes written that we have for examination, but it's never really the 6 minutes because you're entering, you are getting a discussion with the examiner, and obviously you are having a communication with the mother as well. So always practice for 5 minutes. Regarding your scheme, yeah, you heard it right that I said that you have to observe the child first. So in any child, even if the command is not said, uh, your first thing to do is inspection. But in this specifically, I said that observe the child. So you did right that you observed from head to toe. And you knew that you need to look at the eyes, you need to look at the head, you need to look at the journal scars, you need to look at the journal posture. You asked me about the any aids that are present there. There are, just remember that you did not mention, obviously, when it will be there, the hand sanitizer will be there. Just make sure that you or others, anyone, all of you, just keep a practice that use the hand sanitizer, warm your hands, ask the permission. And obviously, right now, obviously, you're just telling me, you're asking me one thing and the other. So we are not communicating with the child. But whenever you are doing the station live and on the patient, make sure to make the child comfortable as much possible because that's the basic key. In your clinical stations, a lot of things matter. It's not just that you're completing the exam because a lot of other exams, like in Pakistan, we have FCPS. In other countries, we have different other exams as well. In those exams, maybe it is consider that you have to complete the steps and everything. But for MRCPCH, the main important thing is not that you complete everything you have uh, you have to do. You have to take care that the patient is at ease, especially the CP children. Okay, so CP children can present in various ways in exam. In a sense that you see that different countries have different facilities available. So if you're giving exam in some of the centers where there are very hi-fi uh, there are very good opportunities available. There are very good resources available. The CP, the cerebral palsy child, may not be in a very bad condition, but in developing countries, like if I say in Pakistan, children we get as a cerebral palsy, they do have this kind of picture that I showed in the presentation. The same, the quadriplegic CPs who are having contractures, who are having these issues and everything. So yeah, you have to decide that how do you have to proceed. So your proceeding was fine in the sense that you generally had a complete look, and then you went to the lower limb examination where we did the inspection. One thing, always look that always ask the parent before. Obviously, you can't ask the child in this case, so you always ask the parent that is she in pain? If I touch her, if I move her limbs, do you think she'll be in pain? Always look whenever you are examining, always look at the face of the child and see that if there is any kind of distress. Obviously, because this child who's unable to interact, who's not having a proper a mental coordination, she's not aware right now, she cannot tell you that she's in pain. So that in that case, always look at the sounds that the child is making, always look at the expressions that the child is making, and then do your examination. So yeah, just spend some time on the on the contractures as well. And then the proceedings was like the tone, power, reflexes, clonus. That's right. After that, whenever you do the examination, it's a must check if the child is can do that. And back is a must. You cannot forget the back. I still remember that cases I gave in Pakistan as well. I did this mistake as well. So yeah, never ever miss the back. That's very important. Other than that, obviously, you when the command is lower limb, you need to set you if you just said, yeah, someone messaged tone, power, reflexes, muscle weight will not be examined and mentioned. Sorry, I can't get Dr. Saeeda Iqbal. Can you please just clarify what exactly do you want to ask? I cannot get your question properly. So yeah, you are going to tell it in your examination, yes, that how the obviously you're going to tell it that what you observed in the examination, you're going to do that, and you're going to tell it as well. Once your command is okay, muscle bulk. Yeah, you're not going to exactly measure muscle bulk. That's not really important, but that's not like a thing that we usually do. But obviously, you're going to comment that there's a decreased muscle bulk bilaterally. Yeah, you're going to do that. Yes. Um, After that, when in this exam, when you have done your command, if you want to proceed further, like you did very well, that you asked me that I want to proceed to the upper limb or the cranial nerves. If you have enough time, they will ask you that yes, you can go to that. You can go to the upper limb and just have a general idea of the tone of the upper limbs and a little bit about the power. And then you can also go for the cranial nerves if that. In this case, I would have yeah, I did mention that the child is having a small head. So I think you could have asked me about the OFC exactly, or you have in a general practice, if you are having a child, whenever a child is not responding or the child is having this kind of issue, always go for the head circumference, because that's really important. That's going to give you a clue regarding that. Other than that, what things are important are that keep interacting the child in between. This is going to tell you that whether the child can hear, or keep a general look and an idea about that. Is the child having any gas feeding tube inside, any gastric tube inside? Is there any scar, especially around the ankles or the knees or the elbows that the CP children can have? In between, if you feel that a child is in mild distress, if the child is coughing, maybe you can extend your examination to the chest as well, and all it of it. But having all this said, if you are not even able to complete the lower limb examination because the child is irritable, because the CP children, they can get very irritable, they can cry, the mother thinks that they're in pain and might not get it properly. Never ever try to just run and do the examination fast. No, you just have to be very, very gentle. Yes, you have to do the examination, but if you are unable to do the examination, uh, complete the examination, don't rush. In the end, just say that I would like to complete my examination by doing this, this, and this. What said is done. This is what the basic exam pattern is. If you see the Mark BT book and the clinical exam in that, you'll see that they write a very small thing that they what they have noticed, and majority of it goes like, I would like to complete my examination by doing this, this, and this. So whatever is said is done. So just be very kind and gentle with the child. Second thing, never ever make findings which are not present there. There can be cases in your examination when there is hypertonia. How to do lower limb examination in this patient? Yeah, that's what I'm going to tell you. That at times there is so much hypertonia that you are unable to check the tone properly. You are unable to check the tone. Like maybe in this child, you are unable to bend at the knee joint. You don't have to push it a lot. You don't have to do such, you don't have to push it to the way that the child gets irritable. You can just have a general idea. In the patients, like in this child, there can be so much hypertonia that you might not be able to elicit the reflexes properly. Yes, that can happen in the cases. Even in one of my cases, I did experience this thing that due to hypertonia, I was unable, there was dystonia in the child as well, and it was rigid. So I was unable to perform, I was unable to elicit the reflexes. So I mentioned it that way, that I was unable to elicit the reflexes right now. Do not tell the findings which are not there. If you have got the reflexes brisk, then tell them. Don't make it a case like this that obviously that there's hypertonia, so the reflexes are going to be brisk, even if you are not, because they're standing there, they're looking at you, they're seeing that what you are doing and how you are doing it. So don't go for telling, because that's a bit major no. That's a major thing that's going to cut your marks. Do not tell the findings that are not there, right? Just be gentle. If you are unable to do certain thing, even if you are unable to elicit the reflexes, just tell them that the child was like, there was hypertonia, I was unable to elicit the reflexes, and then just go with the discussion. So yeah, I would want any one of you, if you want to ask any questions regarding the examination, even if Dr. Namrata, you want to ask any question regarding the examination that you think is in your mind, you can ask that. And then we'll go to the discussion part that uh, how and what should have been done. One other thing, that when there are two types of CP that you can encounter, one that can walk and one that cannot walk. If they're walking, obviously your some time is going to go into the walking, assessing of the walking, like if they're hemiplegic or diplegic or something like that. Your examination is going to start with the walk, and then you're going to get to the other part. If your child cannot walk, so obviously a lot of your time is saved, and most of your attention is going to be the journal look of the child. So you have to see a few things. You have to, obviously, in the head, whatever you said were right. Like you said, the size of the you ask about the shunt, you ask about the scars, you can ask about the sutures as well. And yeah, other than that, you have to have a journal look at the child. You did ask for the diaper dermatitis. You could also have, we could also look for any any other kind of bed sores that might be present, because the child has been laying down, she's unable to move. And yeah. So other than that, journal look of the child, and the rest of the thing, I think you ask for most of the things. If any one of you have any question regarding the examination part, or you have any confusion, yeah, you can ask me at the moment, and then we'll go to the discussion part.
Ma'am, I have one question. So here, what DD we can keep? I didn't listen properly. Sorry. DDs.
Okay, so typically in this very child who is having hypertonia, hyperflexia, you can typically see that there are contractures, the limbs are crossed. So and then we see that the upper limbs are involved as well. So cerebral palsy is going to be your major, your the diagnosis, and you can further say that there can be different causes of cerebral palsy, I would like to, you can further specify it, obviously. Who's going to tell me the types of cerebral palsy?
So there are multiple types like spastic CP and choriothetoid CP, mixed CP, atonic CP, like that. And spastic is further divided into hemiplegic, diplegic, and quadriplegic.
Yeah, so that's what we are going to tell in this, that this is most likely a case of spastic quadriplegic cerebral palsy. It can be due to the etiology can be of vary. It can be of different etiology, or the cause can be varied. It can be intrauterine or prenatal, natal, or postnatal. Yeah, you don't have to offer further diagnosis, further DDs, obviously, because this is very obvious in this child that it's a case of cerebral palsy.
So can we keep the degenerative brain disease or any post-infective sequelae because we don't know the history? So can we keep
We,
these as
we,
that?
we Yes, that's right. But the post-meningitic is going to fall into the CP thing as well. Because what are the postnatal causes of CP are the trauma or meningitis, or that can happen, right? Regarding the disease, degenerative brain diseases, yes, they do cause this kind of issues, but this amount of that can happen in certain other cases, like if the child is somewhat having other kind of movements, if the child is having any dystonias, they're having any other kind of abnormal movements, or that can be a case in which the examiner is going to tell you something like that. So I'll tell you that in one of my cases, like I know I don't have a lot of cases, yeah, but in my neurological case, my command was that examine this, I don't remember the age, maybe 7, 8 years old child. She had a rash at 1 year of age. You have to do the neurological examination. Okay. So what comes in your mind when I say this command? What specifically would
So
you think?
SSP,
Yeah.
SSPE.
Yes, yeah, that's right. But unluckily, that did not come to me in my exam. I could not apprehend it at that point of time. What I thought of fever and rash was that probably the child had meningococcemia, and this is a post-meningitic sequelae. So I kind of get into that as well. But when I examined the child, yeah, the child was having dystonia. The child was having sudden jerky movements, the clonic movements, myoclonic jerks. Yeah, precisely. Yeah, the child was having myoclonic jerks, and yeah, the other features were like this. So yes, in that case, I did put that the most likely it could be a case of SSPE or the degenerative or the CP. But having said that, they do not want you to have a lot of uh, thinking, obviously, because you're not going to have history. So if you are clear about your examination findings, and you can defend it. If you are saying degenerative brain disease, you need to defend it. How are you going to say it? That I need to take history, and then you can defend yourself. Otherwise, if they are very persistent, you might mention it. If they're not, if they're happy, because I've seen examiners who are happy with, if you're just telling them cerebral palsy and you're telling the type of the palsy and the causes of the palsy, they're happy with that. So that depends on the center to center and the examiner to examiner as well, right?
Okay, thank you, ma'am.
Okay, so yeah, so we were seeing that bedridden. Yeah, I was telling you that whenever we're having a last few points of the child who cannot walk, so always look for the back, in a sense that one thing that you have to see is any meningomyelocele scar surgery, anything, or maybe scoliosis can be present in the back as well. Then you have to have a general idea of eye, ear, mouth, nose, and any of the stomas that are present, any of the scars that are present. So that's mostly about it. Regarding the explanation, now the explanation and discussion part. Uh, okay, we were having discussion with Dr. Namrata, right? Sorry, I forgot the name that we were discussing. Yeah,
Yes, yes.
yeah, Dr. Namrata, you completed your telling. Would you like to do it again for me? Yeah, would you? I know that was a pressure time. I want you to tell it again to me. At that time, you did it in around 40 to 45 seconds. This time frame is okay. I want you guys to practice your findings in a way that you complete it in maximum 40 or 45 seconds. because it's going to be a 3-minute discussion station. If you are going to take more than 1 minute in just telling your findings, that's going to cost you your other parts, because there is 2 marks are for the 2 marks are for the findings and everything. 2 marks are for the investigation and the reasoning, clinical reasoning, and then the 2 marks are for the management. So if you're not going to go to the management part, you are slow and you're not speaking a bit fast and you're not going to take the examiner to the management part, you might lose the marks in that. So I would like you to repeat your findings again in a more precise way, in a more clear and complete way. Yeah.
So today I got a chance to examine a 6-year-old girl, Alia, whose weight looks decreased, but I would like to plot in a growth chart. The head is also, size is also decreased, and there is no obvious dysmorphic feature, but there is a bilateral splint present. On examination of the lower limb, there is a hypotonia. The power is 1/5 in the lower limb, and the reflexes are brisk with the clonus present and bilateral upgoing Levinsky.
Okay. So what's missing in this is that on the journal look, you can see that the child is having this crossed legs, right? And the child is not oriented, and the child is having small head, and she's unable to communicate. So maybe you can tell all of these findings in your journal impression initially as well. That's going to make a difference, right? And regarding the lower limb, you first need to tell that, yeah, you're on your inspection findings. So what are your inspection findings of the lower limbs?
There is a lower limbs bilateral decrease muscle wasting.
Yeah.
The bulk is decreased, and then there is a lower limb scissoring. There is a
Yeah. And maybe you can even mention that I could not see any scars, any other visible marks, right? Or maybe if you can see that you can. Whenever I mentioned that whenever you're mentioning about the lower limbs, after mentioning the lower limbs, you have to further continue that the child is still in diapers. The back is normal, and I would like to complete my examination, blah, 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 like that, right? So I would like you to just practice a bit on more and be a little more expressive on what you have on a journal inspection. This goes for any case. I know examining and then focusing, and yeah, it's a bit of panic mode and you get distracted by a lot of things, but keep practicing whenever you case, and then we next, regarding we come to the discussion part, I would want you to be further, just give me a second. Yeah, sorry for the inconvenience. Yeah. So cerebral palsy is one of the topic in which you should be very fluent in what are you going to do as in the investigation part, or what are you going to do in the management part. This is something that you should not even think about, even in the causes. Okay, so it should be in your on your tips that yeah, this can be a case of prenatal, in the prenatal, postnatal, natal. Prenatal can be this, natal can be this, and the postnatal can be this. If the examiner is asking you for that. Okay, in the investigation, yes, you are going to do the MRI, but other than that, you can go for the complete hearing assessment. You can go for the complete eye examination as well, right? Maybe if the child is looking pale or something, you can go for that. And maybe if maybe you've seen a lot of investigations, and further you can say a line that depending on I'll see a previous, you can even say that I'll go through the red book, and I'll go to the red book of the child and see that what investigations have been done previously, and if any investigation has to be done now. If the etiology has not been concluded yet, I would like to do an MRI or maybe some other blood testing to know the exact cause of the cerebral palsy. Other than that, if the child is having any acute issue, I would like to investigate for that, right? So you never ever stop in the thing. You need to be fluent. And then in the management, I want you to be really fluent in the exam, in the description of the management of the cerebral, in any case, but in cerebral palsy. It shouldn't be a thing, something that I would like to have a multidisciplinary team approach in this child, because this child is bedridden, having contractures right now. So I want to have a neurologist on board to see if the child is having seizure. I would manage that. Currently, I want to manage the increased tone and the contractures of the child, for which I can give certain medications. and then if we can even go for the surgery and we can have a surgeon on board. Other than that, I would like to involve a physiotherapist and occupational therapist on board to help the child and do a detailed hearing and the eye assessment. I would like to help the parents as well as and go for the social services and see if they need any social help. Yeah, this is a basic thing that you can tell in the CP, because you see that the CP has a lot of problems and there's a list of multidisciplinary team that is involved in the CP. But for the short case, what problem you are experiencing in the child, maybe if the child was having an NG2, maybe you could have discussed that in your management. But specifically in this very case, it's really, really important that you tell about the management of the contractures. You mentioned the role of the physiotherapist, occupational therapist. You mentioned the role of the developmental pediatrician. You tell me the role of the social support. This is all because maybe there's not a lot of time, and maybe you're just going to take the name of the multidisciplinary team, and you're going to take the name of all the specialties, and the time might get over. But the examiner will get to know that yes, we're not there to just treat the cause, because there's no cause of, because that's not an acute issue and there's not a single thing that you're going to manage right now. There's multidisciplinary things, and the examiner needs to know that what should be your action plan regarding this child right now. So that's what I would like you to suggest in that. Would you want to ask anything or you have any confusion, Amrita? And then we'll have a little bit of discussion on journal discussion on cerebral palsy.
Yeah, actually, you were stating that the upper limb has some movement. What was that actually?
Yeah, because it can have yeah, you might have asked in detail, but I skipped that purposefully because I was thinking to tell you that she was having a posturing, that you say that the dystonia, but then I decided not to mention that. Yeah, that's case to depend. That's case to case. You don't have to worry about that. But you need to have you gone through the cerebral palsy topic? Yeah, and have you planned for?
Yes.
Yeah. So I really need you to have very, very good lines, memorize good lines of the management of it because it's a very important case. Where are you planning to give the exam?
Yeah, in Nepal.
Okay, so I believe that you might have a lot of cases there as well, and it might come in the exam
Yeah,
frequently.
we have a lot of
Yeah.
cases.
Yeah, the same thing is here as well. We have a lot of cases, and most of them are not in a good state. But yeah. One other thing that happens in the centers, a lot of centers, is that what I was telling you about the practicing, that when you go, the patient might not be fully undressed, and patient might not be fully prepared for the examination. Sure, at times a lot of time is being spent on exposing the child. It might happen that you are just pulling it up and it's getting difficult for you to expose it. So your time gets wasted in that as well. Yeah, other than the short cases, the short clinical stations, you must have gone through the recalls and the clinical, this comes a lot of cases times it has come, and the long cases as well, the history station. And obviously, it does come in the development station as well. So it's the topic that is covering almost all of three of the major stations. So you should have a very good approach. Whenever you are approaching a child with cerebral palsy, you should have this thing in your mind that what are the problems? Yeah, we're having a journal discussion, a 10 minutes discussion on the cerebral palsy topic. In the clinical station, we have mentioned that, but in journally approach to cerebral palsy in the history station as well, you know that there's a list of problems that is associated with the cerebral palsy. If you start from head, we'll just start from the head. You know that they are not mentally sound. They have decreased IQ. Decreased um, they have decreased cognition, and they are unable to really focus on a lot of things. So that's your first thing that comes to mind. So you need to have a management plan for that in your mind. When you come after head, you come down, and there's microcephaly as well. Then you come to the eyes, and they have squints, they have visual other visual issues as well. And they might have glasses, they might have some abnormal eye movements, they might have some nystagmus as well. So that's come to your second thing. So it can be other visual field defects as well. Then we come to the ears. They can have the hearing issues. It can be conductive or the sensorineural hearing impairment. Then when you come down, they can have the mouth. You can have the mouth issues. They have a lot of issues with the gastroesophageal reflux, oromotor incoordination. There can be aspirations, and then from the mouth you go to the GIT, and then they have different issues like constipation as well. Then the respiratory, that they're prone to getting the respiratory infections. They're prone to get the chronic lung disease, aspiration pneumonias. Yeah, and then obviously due to decreased eating, there are nutritional issues as well. Then if you go to the other neurological issues, they might have epilepsy, they might have behavioral issues, then they have speech and language issues for which you are going to do, and then they have obviously urinary tract issues as well. So orthopedic issues, in the orthopedic issues, they can have hip subluxation or dislocation. That's a very important thing. And that's one of the common scenarios in the history as well, where you get there's a certain pain in the anterior thigh, and you can get, and that's the issue, that there's hip dislocation, and then there are painful muscle spasm. They can be spinal deformity and osteoporosis as well. So these are the list of the problems that you are having. Now you need to have a good approach on managing all of these. So obviously you're going to have a social worker on board, you're going to have a psychologist on board, you're going to have a dietitian, a pediatrician, a behavioral therapist, a speech and language therapist, an occupational therapist, a physiotherapist. That are all of those. And then you need to know that everyone has this and this and role. Other than Hi, sorry, I think everyone got muted. Yeah, so sorry, can you hear me now?
Yes.
Yeah. Okay, so I was asking that, can anyone of you tell me that what is respite here? I think that got muted.
So in this long-term disability like chronic diseases, this
Yeah.
respite care, they give like a break to parents. So they will take care of the child in that time so that they can take a short break or go on a vacation,
Yeah.
the carers and the parents.
Right. That's right. Yeah, because that comes as a very important question in the management of the cerebral palsy. And even maybe you can mention that uh, in your discussion on your management as well. You see, have you gone through the long case of the Mark BT notes of the cerebral palsy?
Yes.
Yeah, so you might have listed there that there are a lot of investigations that are written there. So you
Yeah,
don't have to
actually, I
tell
was very
all.
confused, like either to say all the that routine investigation they have written.
Yeah, so it's about how you say them. Obviously, you're not gonna say that I'm going to do this, and this. It's about how you say them. That I'm gonna go and review everything, and I'll see that if there's a need of doing any of these things, and maybe you can mention a few things in that, right? So, and yeah, I'm sure that you probably know the role of every therapist. That's a list of the therapists that has been mentioned there, and I'm sure that you know about that as well. So overall, cerebral palsy is a very, very important topic in every meaning, and I hope that some of the discussion that we did today was helpful. Want any one of you, if you want any to ask any questions, Dr. Namrata or anyone want to ask any question regarding clinical examination or anything, I would happy to be answering that. Yeah. Okay, no questions. Okay, so Namrata, my final comment would be that yeah, it looks like that, yes, you have been practicing, and yes, you have a good approach to a lot of things. Just be a little bit more confident and speed up a bit in specifically the clinical answer discussion, the clinical station discussion. You see, I know it's the most difficult part and the most uh, tricky part of this exam is that in certain stations you have to have a slow down pace, like in the communication station you have to have a very slow pace and you have to be considerate and everything, and in the history as well, maybe in the development as well. But then the clinical stations you have to be a bit fast, you have to have things one two three and this and this, and then you have to move a little bit faster. So maybe you can practice that on a bit and just be confident on whatever you are saying, and yeah, and just be sure of what you are saying. Just keep in mind that this is the child that I am going to manage. This is the child that I'm going to go give the DDs for. You are not going to give journal. Like, I know we do make a list of differential diagnosis. We do a lot of things that we have memorized over the time. But in that very point of time, just focus that how I'm going to do something, I'm going to help this child, I'm going to do something for this child, because that's your case which is going to be. And let me tell you that you think that neurology station is very difficult and all that, but they know if the case is difficult, they know if it was something that, and they're not going to judge you if you are doing something which was beyond expectation. Like my case, the examiner, she wrote down in the end that a good performance on a very difficult case. So they knew it was a difficult case and there was a difficult discussion and the child was difficult to deal with. So they did notice that and they know about that. So don't worry, just keep your practices going on. Go to the hospitals and always practice some random case of which you do not know, or you don't know what are the findings already, and do that thing and have someone who's watching you. Always set a timer of 5 minutes, do your methods and everything, and then read it, and then prepare for the discussion and ask for the DDs and investigations as well. So yeah, we have a question. When and what will be the next topic? Okay, so when, yeah, we'll have a session in next week, maybe Friday or Saturday. I'll just post in the group, and we are open to the topics. You guys can give the suggestions and we can opt any of that. And we have a good number of participants today. I'm glad about that. We have around 60 participants. So we have 5 more minutes. Please ask any questions that you have, any of the confusions that you want to clear. Because obviously, if you're preparing for the exam, I'm sure that you have at least 100 questions in your mind.
Dr. Iqra, can the examiner ask us about the counseling of the parents?
Yeah, this has been noted that in a few stations, yeah, they did ask about that. What are you going to tell the child about? That came in one of the in the different scenarios. I mean, if it happened, I think they asked in the musculoskeletal when there was a case of probably Marfan syndrome or something like that, and in one or two of the other cases as well. So yes, they can ask you, and in that you have to tell. There probably one or two important points that you have to tell to the parents. So they're not gonna obviously tell you to make a long communication or something. They're probably asking for one or two important points what they have in their mind. So yeah, this can they can ask this as a question.
Okay, as you know, the cerebral palsy is a lifelong condition. So how can we
Yeah.
counsel the parents this condition? Uh, Within few, we can help us.
Yeah, so what we can do is that we are going to give them that we are here to support you. They are obviously, we are going to ensure them that obviously we're going to tell them what exactly is the cause, and we're going to tell them what the solutions we have for the problems. And it's not going to be like that the child, we cannot bring any improvement in the child. Our main focus is to give a safe environment for the child and whatever improvement that we can make in the child, because obviously you see there's a list of therapies that can be done. We have solve therapy, the speech and language therapy, which help with the speech of the child, which also help with the oromotor coordination, and they're going to be telling them how to eat as well. If the child is not, just we're taking the problem of the feeding in the child, suppose we're counseling about the feeding. If the child is unable, then obviously we have the option of the NG tubes, then we are going to guide you about that. Then we have a nursing staff trained who are going to tell you how to go with that. If that, when that's an issue and the child is having recurrent gastroesophageal reflux, then we can maybe even go for the gastrostomy tube. And similarly, if every problem has a solution, so we are going to tell them. Other than that, we're going to tell them that yes, there are going to be special health workers coming to your home. They're going to help you modify, do some modifications at your home. We are going to uh, apply for the social help as well, which the disability living allowance is being given. And then there's always a respite here where you can just send your child and then you can have some time of your own. So these are the things. Obviously, you cannot, you're not going to tell them that things gonna get like it's gonna be all okay, but there's always something hope and some help that you can provide them. And yeah, but they that's not the case. In this case, this and that, they're not going to tell you to, they're definitely going to ask you to tell the parent about a specific thing. Like maybe what I told you about the feeding issue, what are you going to do of the feeding issue? What are you going to do about the contractures issue? What are you going to do about the mobility of the child or something like that? And then this can always be a question about the further child. What are you going to tell the parents about the further pregnancies? Then you can obviously tell them that we are going to refer the parents to the genetic team and they can help them in the further decisions. Yeah, so I hope it was helpful and you did get some insight about the clinical station that goes on. Uh, Let me know if you have any of
Yeah,
the.
it was very, very helpful. And I was very nervous.
Yeah,
Dr.
thank.
Iqra,
Yes.
okay, you have time. That's why I'm going to ask one question.
Yes, yes.
Actually, there are like 50 problems or 70 problems or 60 problems in CP child, many, many problems. When you are
Yes.
going to examine or when you are going to take history, really, especially for me, in FCPS, okay, there is too much time. You can gather the information. You have time for examination, but really time is very short, especially in MRCPCH.
Yes.
So how to overcome this one? Really, such every problem have detail, spasticity. There is detail, vision or NG tube. Really, there are big parameters you have to answer at that time. So how to deal with this thing?
Yeah, thank you for asking it. Okay. So the thing is that whenever you're going to get a scenario in this exam of cerebral palsy and history station, there's going to be an acute issue that's happening with the child. If I
Okay.
remember, one of the recent cases that come was that the child was having pain in the anterior thigh, and you had to make a differential diagnosis of that acute problem in that child. That was most likely, some people said that it was some abscess, but I think most likely it was due to the dislocation of the hip joint because of the increased tonicity and increased contracture. There's a probability of having that dislocation. So you have to go into the detail of, like we do that, of the presenting complaint. You have to go in the detail and you have to make a differential of that one thing in complete detail, right? Other than that, you are
Okay.
going to have one-liner questions about other things, about every other system. You're going to have one-liner and just assess that. What's the status of that? Not to go into every issue every time. Like then again, when you go to the past history, you'll ask for the previous examination and previous admissions, and you see that a cerebral palsy child might have been admitted a lot of times in the past. You're not going to take detail of every past hospitalization. You're going to take maybe you're going to take history of the last one and maybe the most severe one, that what happened at that time. You have to manage your time, right? So you cannot get into the detail of each and everything, and they're not going to judge you for that. They're going to approach you that you just need to find out that the problem and what solution have they been. Like if you ask that, okay, does he have any feeding issues? So if they tell that, yeah, he has this issue. So what has been done for that? Does the child has constipation, or can you tell me his bowel habits, or can you tell me about the child's poo and pee? So the parent might say that yes, he has constipation. So are you doing something for that? Are you following any doctor for that? Are you taking any medication for that? Yeah, you're not going to ask the detail of the constipation, that how many stools does he pass, how you're not going to go for that in these kind of cases.
Thank you so much.
Yeah. Thank you so much, everyone. Good job, Dr. Namrata. Thank you so much for volunteering, because without a volunteer, there's no point of having these classes. Final request to all of you is that please ask question in the groups. Please be open. Just write a message, drop a comment. And I think I have posted a question from yesterday about the guidelines, from the guidelines, and just go through that. We have a Telegram group as well. We have an active Facebook group, Facebook group as well, and we have an active WhatsApp group as well. Do reply to the activities that we post daily, and hopefully we'll be seeing you all in next week with some other topic, and do drop in the topic suggestions as well. Thank you so much, everyone. Have a
Thank you
very
so
good,
much.
yeah, thank you.